I'm going to dive deep next to the bladder and the prostate, and I'm going to find the little noodle that's deep in here, and on you it was a little lower where it was referring down. Too much?
Nope, it's good.
Our friend Marcus here is having some issues down in the private area, and he's come out here from Michigan. And so what we've been doing is palpating the pudendal nerve. A few people on Instagram have been asking us about pudendal nerve stuff. So what I did over here is I drew his piriformis at the bottom. His sciatic nerve is right here. That's this thicker thing right there. This nerve that comes out underneath the piriformis and it wraps around this ligament right here. It's a sacrospinous ligament, and it goes deep in here as the pudendal nerve. I was just showing Casey how we were going to tension the pudendal nerve with the sacrospinous ligament, and Marcus said that he felt symptoms inside of his pelvic bowl. And when I'm inside of his pelvic bowl, right inside the femoral nerve, the psoas and iliacus, and I'm deep next to the bladder and the prostate, I was pushing in that area, and it said it reproduced some private area symptoms and also some groin symptoms that he sometimes feels when he's walking. He'll feel the groin and his genitals at the same time. So the fact that you can reproduce symptoms when we do the stretching test for the pudendal nerve of the sacrospinous ligament or palpating inside the pelvic bowl, and it reproduces that symptom, that's a really good sign. So what we're gonna do now is I'm gonna show you again what it looks like to do a pudendal nerve pass at the sacrospinous ligament. And we can see if we release the symptom at all for Marcus. So right now I'm right next to the nerve. I'm taking tension onto the nerve, and now I'm locking it in. Go ahead, Casey. And now Casey's pushing his femur in, and then externally rotating and dropping the knee down as I'm applying tension, and I feel moderate tension on his pudendal nerve. There's definitely tension here. Still okay, Marcus?
Yeah, I'm good.
Go. I'm gonna do a few passes back here,
Okay.
and then we're gonna check the pelvic bowl. Good.
The pain level on that one was better.
Less.
Yes.
Go. Good. Good. Go, Casey. Good. Go. Last one here. Good. Okay, so now what'll be interesting is if it feels less tender or less sensitive or shoots less, then that tells us that we've released some tension from the backside of the pudendal nerve before it got into the pelvic bowl.
Okay.
Does that make sense to you? And if not, then it means that we missed it or it wasn't related. So the pudendal nerve, if I find psoas iliacus, his inguinal ligaments right here, psoas iliacus is running where my two fingers are, and then I'm gonna get just medial to those. I'm gonna use this hand so that I can really lean in with my body, and I'm gonna dive deep next to the bladder and the prostate, and I'm gonna find the little noodle that's deep in here, and on you it was a little lower where it was referring down, and it was right in this area. Is it shooting?
Not it where your forearm is. It's still burning by touch, but the pain, the sharpness is not there like it was.
It's less intense.
Yes.
It's really
But
good.
it does burn.
How much less intense? Be honest.
I don't feel any sharpness.
No sharpness, but it's
at all,
burning.
But it's burning.
Got it. Tell me when it starts to burn.
It's burning.
It's burning. I just want to make sure that I don't have a lot of, it feels a little stuck right there. That's on the prostate side, so I'm gonna go on that side.
No, I'm feeling sharp pains.
Okay. Go ahead, Casey. Tell me if it's too much, Marcus.
It's okay.
Good. So one more pass here. Go. Too much?
Nope, it's okay. It just burns.
Good. So we just did 3 passes in the pudendal nerve at the pelvic bowl. We did a few passes at the sacrospinous ligament. So I'm just curious, lie on your back. More tender, as tender, or less tender than before?
It's tender. As more tender. I would
More
say.
tender.
Yeah.
Got it.
But just because you've been rubbing on
Yeah, I got it. I got it. Good. Comes out of the sacrum, S1, S2, S3. Your belly button's like right there.
Mm-hmm.
So when I was like poking in here, you were really tender right in this area. So I was treating some of these nerves as they're going inside the psoas, right in there.
Mm-hmm.
And then you can see that that purple nerve, it goes behind that ligament. That's the ligament I drew on your butt. So when you see the video, you're gonna be able to see the ligament because you could feel it on the backside.
Okay.
And then it comes back inside the pelvic bowl. And then when I was pushing down in here, this was the area right in there that was referring and shooting downwards.
Okay.
So we treated the spot right on the back side of that ligament. And then we also treated the spot over here on the left side and the right side, because you can see it right inside the bowl right in there too. And the spot on the left was the one that was, you said it was shooting all the way down. So the good news, and when we were done, you said you were lying on your back, and also we did the cat-cow, and the sharpness you had in this area where those nerves, the pudendal nerve originates, had gone away. So I'm optimistic that you're gonna have sustained relief from this, and whether you need a couple more treatments or whatever, I don't know. But so far, this is really good.
Yeah.